In first looking at our critical thinking questions, in question 1, upon the first impression of the patient, based upon her actions of desiring a bottle, presumably this being alcohol, combined with the erratic behavior of her being disoriented with combative and aggressive behavior towards those who are helping her, the first thing that one would suspect of her would be that she may be going through symptoms of withdrawal. Evidence for this would also include that of her shaking hands as well as her clouded mental faculties. However, while this may be the first suspicion, upon further investigation, what would more than likely be her diagnosis would be that of alcohol use disorder. When looking at the signs and symptoms of alcohol use disorder, we see that the patient meets several of these signs and symptoms. According to the Mayo Clinic, in their article about alcohol use disorder, they list sweating, rapid heartbeats, hand tremors, feeling a strong craving or urge to drink alcohol, as well as the symptoms that are more common with those of withdrawal, such as nausea, sweating, and shaking when alcohol consumption is not taking place. In the second question of the scenario, we see that for this patient, there are several long-term health risks that would be able to be observed. And once again, looking at that same Mayo Clinic article, they list many of the long-term health problems that can occur for patients who consume alcohol over a long period of time. These long-term health problems can include those of liver disease, caused by increased fat in the liver due to heavy drinking, in addition to inflammation of the liver, which in turn can cause irreversible destruction and scarring of liver tissue. Other major long-term health problems that are seen include that of digestive problems via the inflammation of the stomach lining. And for patients who exhibit the symptoms of alcohol use disorder, heart problems are often common. This is mainly due to high blood pressure caused by excessive drinking and an increased risk of heart failure or that of a stroke. Other notable health problems that patients with alcohol use disorder deal with on a long-term basis include that of sexual function and menstruation issues, eye problems, birth defects, bone damage, neurological complications, a weakened immune system, as well as an increased risk of cancer. In the third question, we see that the patient is dealing with shakiness as well as her combativeness and confusion. According to WebMD, this is primarily due to the fact that the buzz from the alcohol is worn off, and as a result, the patient will begin to suffer symptoms of withdrawal, which include symptoms such as those of shakiness, restlessness, a racing heart, and seeing, hearing, or feeling things that are not there. All of these symptoms combined can be seen in the patient's shaking, as well as her confusion and combativeness against those who are trying to help her. In the fourth question, we see that the assessment that is needed for this patient is for her to be diagnosed with alcohol use disorder. In the same article from WebMD, once again we see that in the assessment of the patient, if the patient is suffering from alcohol use disorder, there are a series of questions that must be answered by the patient in order to determine their level of addiction. For example, such examples of questions that are asked include, starting with in the past year, have you tried multiple times to cut back or stop drinking, but you couldn't? In the past year, have you continued to drink even when it caused tension with family and friends? Or, In the past year, have you kept drinking even though it made you black out, feel sad or anxious, or made another health problem worse? Through the use of questions such as these in the assessment of the patient can go far in determining if the patient suffers from alcohol use disorder, as well as how badly. These questions cover anything and everything from the habits of the patient, how it has affected their relationships or work, to even questions in order to assess the mental health of the patient. In looking at our research question, we see that within the last decade, there has been a great deal of discussion about mental health issues and the right of health insurance. One of the key laws that's been passed to deal with the issue of mental health coverage being required to be covered by health insurance was passed in 2008. This law, also known as the Paul Wellstone and Pete Domenici Mental Health Parity and Addictions Equity Act, requires that health insurance providers cover the services of mental health, behavioral health, as well as those of substance abuse disorders in a way that is comparable to that of physical health coverage. The example that the American Psychological Association uses is that should a patient go to a mental health professional, the insurance company is not legally allowed to charge that visit with a $40 copay when, under the same insurance, they only charge a $20 copay for regular office or medical office visits. This system is far from perfect, however, as the law requires that these mental health benefits are only offered. There is no way of stopping the health insurance providers from placing restrictions on the type of coverage that is provided, as well as they are still allowed to specifically exclude certain diagnoses. In a report recently by the NPR in November of 2017, nearly a decade after this law was in place, investigators found that health insurers were still shortchanging those who are insured by them. Several of the statistics that were found in the national study were that in 2015, behavioral care was 4 to 6 times more likely to be provided out of network than medical or surgical care. Insurers paid primary care providers 20% more than the same types of services than those paid for addiction and mental health care specialists. From just these points alone, we see that there is still a problem when it comes to getting mental health care that should be provided by health insurers. Not only is this not sufficient, but they also have legal loopholes that enable them to get out of any specific diagnosis that they list, just as long as they do have some available mental health coverage.